Okay, we're going to look at exercises for the foam roller, focusing on the quadricep muscle and also IT band, which the muscle tensor fascia lata inserts into, as well as glute max as well. So the quad at the front of the thigh here can often get tight through excessive training of cycling and running. It's a very dominant muscle, usually stronger than something like our hamstrings. And then we have the IT band, which runs down the side of the thigh, and that can also get tight from excessive sort of overtraining of running or cycling, or perhaps a change of training intensity or volume. So going from perhaps 1 to 3 sessions to then suddenly doubling the following week. Obviously you want to gradually increase the training to avoid injuries like that. But what it can cause is pain to the lateral side of the knee, the outside. So these exercises will help to strengthen that, stretch that, I should say, and avoid any issues around the knee. So looking at the quad to start with, both of these we're going to look to roll 3 to 5 times per muscle, and then we can gradually increase from there. To start with, it'll feel quite uncomfortable, maybe painful, depending on how tight your muscles are. So start 3 to 5 times. Once you're warm, perhaps after a warm-up or a gym session, and then increase the number of times that you're rolling for from there. So just gradually adding, perhaps 1 every couple of weeks. And just make sure you're warm, because you've got plenty of blood in there. It's like having a cold massage. It would hurt if it's cold. So when you're warmed up, the muscle's that bit more pliable, and you'll get better results with it. So with the quads, you can start with both legs on. You won't get such a great result, but you can start with that. Foam rollers above the knee, not on the knee joint, and then you roll yourself down the foam roller to the top of the thigh. Okay. If we go for one leg, it's much more effective. So we just place the other leg, rest the other leg on the leg we're rolling. So I'm rolling the left leg here, the right leg's hooked around the back, slowly roll down. If you have any sore spots, hold it until it eases off, and then continue. And that acts as some trigger pointing through the muscle itself as you're rolling. Nice and slow, not too quick. You get more benefits if you go slow, all the way to the top of the hip. Okay, and you would then repeat that 3 to 5 times. You then do the other leg as well. So you have 3 to 5 times on the left and the right quad. Now looking at the IT band, side on this time, above the knee joint, not on the knee joint. Both feet in line here, and then we'll roll down the foam roller slowly. Again, stopping at any sore spots to trigger point those areas and help to flush in some fresh blood and repair those points. Slowly, slowly down we go. It's going to get more uncomfortable probably as we go through that muscle. And just till you get sort of mid-buttock, mid-glute, then relax, come off, and then repeat that again 3 to 5 times before changing sides. Don't try and roll back down, because it's like a massage. As you roll down, you're creating a bit of a vacuum for fresh blood to be drawn in and to help that area recover. So you're always trying to massage towards the heart, hence rolling down. If you then go back up, then it's going to negate the benefits and play around with the veins and arteries there a little bit too much. So start off gradually and increase as you feel more comfortable. The more frequently you do it, the better the results, and it can help with a lot of lower back issues as well as the knee problems.